Hey everybody, this is Mike Taylor, student physical therapist, and today we're going to be discussing a very serious issue affecting an estimated 1 in 3 female athletes. And this issue is stress urinary incontinence, or involuntary urination due to increased stress or pressure placed on the bladder. So the reason I wanted to do this video, and this has been something I've been thinking about for a little bit now, is that like clockwork, anytime there's a big powerlifting meet that attracts a lot of media attention, especially on Instagram, like there is right now at IPF Worlds in Calgary, it seems like every time a meet like this happens, there's almost always an incidence of urinary stress incontinence, usually during the deadlifts, and it's usually by a female athlete. And then what ends up happening is this moment from this athlete who's, pulling for the win, pulling a PR, doing something very brave by going out there and showcasing their talent and showcasing their strength. That moment gets hijacked by stupid powerlifting memes pages that share it and, point and laugh and want to make fun. And frankly, I think that's crap. It pisses me off, honestly, every time I see it, and I want to take this opportunity now to start shifting the narrative away from stigma and embarrassment and towards understanding, education, and awareness so that people can do something about it. Because the thing is, it's actually super common, but it doesn't have to be that way. Before we get into any more of this, I want to be very clear about a couple of things, and I want to be extremely transparent with you guys. And so first of all, while I do practice physical therapy, I'm a generalist, and I'm also still a student. I am not experienced with women's health or pelvic floor physical therapy beyond just, observation and what I've heard in lectures from people who are experienced in this field. So physical therapy is a lot more than just stretching and strengthening muscles and, learning to move better and move out of pain. It actually encompasses a lot of factors of life. And so pelvic floor and women's health rehab are just some of the factors that physical therapy can address. What I mean though is that that is not my skill set. The information that I'm going to be sharing with you today is stuff that I've learned from my professors and from clinicians who are skilled and experienced in this field, and also from the research that I've done on my own. And then the last thing I want to be very upfront about is that unlike previous videos where I've demonstrated, stretches and exercises that you can use to help address certain issues, this video is not going to cover anything like that. I can't help you through the internet, and also, like I said, that's not my skill set. But what I am going to share with you at the very end of this video is a helpful resource that you can utilize to help find a skilled licensed physical therapist who is experienced in this area, who can help you should you desire it. So with that out of the way, let's talk about incontinence. And the first thing to understand about incontinence is how our genitourinary system should work. Throughout the day, as we drink liquids, we store that liquid in our bladder as urine. And when our bladder becomes stretched to a certain point, it sends signals up to our brain that then send signals back down to our bladder that tell us that it's time to go. And so when this happens, the muscles that surround the bladder constrict and squeeze to help expel urine out, while muscles at the base of our bladder towards our urethra that surround our internal and external sphincters, our pelvic floor muscles, actually relax to allow urine to flow freely. But what is it that causes us to go when we don't want to? So it's important to understand that there are multiple types of incontinence, and today we are just dealing with stress urinary incontinence. Essentially what happens is that intra-abdominal pressure becomes greater than the back pressure created by the pelvic floor muscles. So when we do things like cough, sneeze, pull a world record deadlift for the win, or anything that causes us to increase intra-abdominal pressure like that Valsalva maneuver, any of that is going to increase the intra-abdominal pressure, and our pelvic floor muscles then have to respond appropriately to create an appropriate back pressure to prevent urine from flowing when we don't want it to. If those pelvic floor muscles are not responding appropriately, as they frequently do in women who have this dysfunction, what can happen is leakage. So what can you do to solve this problem? Much like in powerlifting, when we have a set of muscles that are weak, we strengthen them. And this is really no different. And unlike a lot of areas of physical therapy practice where the evidence is just kind of, so-so, there's actually a lot of really good research out there supporting the use of biofeedback mechanisms such as musculoskeletal ultrasound to help in pelvic floor muscle retraining. Because those muscles are not easy to see or feel, like our biceps or our quads, where we can easily see it and we can tell that we're doing the contraction correctly, the pelvic floor muscles are deep inside of us, and it can be difficult to really know if we're working them correctly. By using a device such as MSK ultrasound, we can help visualize that muscle to the patient, show it up on a screen, and they can see that muscle shorten and contract, and they can see it lengthen and relax, so they can then learn with their brains what the correct contraction should feel like. Once they've mastered that contraction with the biofeedback, they can then transfer it to exercises such as Kegels and other pelvic floor exercises in different positions to work on improving their strength, improving their motor control, and improving endurance. And so over time, our goal here is to, improve the strength and function of the pelvic floor muscles, and what that leads to is decreased leakage and improved overall pelvic floor function. Additionally, in people suffering from back and hip pain, it can also be helpful for that as well. And so as I mentioned earlier in the video, today I'm not going to be showing you how to master this contraction yourself. That is way beyond the scope of this video. But what I am going to show you is a helpful resource that you can utilize to help you find someone who can help you near you. And so what you're going to do is you're going to get out your computer or whatever you choose to use, smartphone, tablet, and you're going to go to www.pelvicrehab.com. And it's going to take you to this page right here, and you'll see that there's a pretty nice homepage, and you could find a pelvic rehab practitioner. You can either go by location, or if you know somebody's name already, you can go by name. I don't know anybody by name, so let's say we want to find somebody in San Antonio, like where I am. So I'd do that and click find, and as you can see, a list of people pull up right here. So let's say I want to learn more about Tish Rodriguez, who's an awesome provider, by the way. And so I'll go to view details. There's a phone number, there's an address. You can go to more details there, and it'll take you to a little bit more detail. Some people have more than others, so you can see where she works there. And so let's say I wasn't in San Antonio, but I was actually in Orlando, Florida. You search for Orlando, find, and a whole new list of people show up just like that. As you can see, if I zoom way out, you can kind of see all of the providers that are across the United States with this specialty. So if you're in Nebraska, or if you're in Georgia, or if you're in Tucson, Arizona, there's going to be people there who can help you out. And so I just wanted to share this tool with you because I think this is really powerful, and I didn't know about this until very recently. So as you can see, there are people all across the United States, and even if you go up into Canada, there are people there as well. All people who are skilled and licensed in pelvic rehab, who you'd be able to direct your questions to, who you'd be able to contact. So I'm not trying to tell anybody what they should do with their bodies. That's totally up to you, and this is not official medical advice. But what I want to share with you is that there is a lot of evidence supporting the use of physical therapy and pelvic floor rehab, and that these people are out there. They are out there, and their contact information is freely available, and you should seek them out if you choose to do so. Unfortunately, I can't tell you, who will take your insurance or who has direct access, but what I can tell you is that if you choose to do that, I believe it would be a good investment of time and money because it can lead to better quality of life overall. So to everybody competing at IPF Worlds, competing at the local gym powerlifting meet, or just lifting weights for the fun of it, I just want you to continue doing you, but never let somebody make you feel bad for being strong. If you do choose to seek out care, just know that those resources are out there, and there's nothing wrong with bringing up this topic. And to my fellow providers out there, I think we really need to do a better job of discussing these things with our patients. We need to do a better job of bringing it up because it is such a taboo topic that people are not necessarily always comfortable just freely discussing it with us. So it becomes incumbent upon us as the provider to ask specific questions and to be someone that they can rely on and somebody that they can trust to help them get the care they need and to just listen to them and just hear them out. So it always means a lot to me when people comment on my videos or share it or tag friends. I think that sort of interaction with people is really cool. But with this video especially, it would mean the world to me if y'all could help me get the message out there. So share it, tag a friend, send it to a family member, tell your neighbor about pelvicrehab.com. Just help me do anything you can to help normalize this conversation. There are too many people suffering alone for us to not feel comfortable talking about this. And really, there are too many good options available for getting better for us to not feel empowered to seek them out. If nothing else, I really just hope this video has helped you gain some awareness of the issue at hand so that you don't participate in humiliating somebody who has it happen to them. This is not a laughing matter, and if you are still participating in that, you should be ashamed of yourself. So thank you so much for watching, everybody. This has been a good one. As always, happy training and good luck at IPF Worlds. Go Team USA.